everybody, it's Dr. Roth. This is going to be our Topic 8 lecture for articulation and phonology. So we'll just do a little overview of some of the concepts that we're going to be covering, as well as at the end, I'm going to review some common areas where people struggled on the midterm. And that way, if you want to just go back and make sure you're understanding the concepts, or maybe even get a little bit of a jump start on the final, to make sure you kind of grasp those midterm concepts, start kind of reviewing them now, and then when we get the final review, then you can kind of combine the information. Okay, so for topic 8, we're discussing intervention for therapy for articulation disorders. So we're going to be focusing more on that articulation side as opposed to the phonological side of things. So for this, we're going to focus more on the traditional motor approach, including guidelines for beginning therapy and the application and how it applies to both articulation and phonology. But again, we're going to kind of stay emphasized on the articulation component. And then we're also going to discuss some common sound elicitation strategies that we might use in therapy for working on articulation sounds. So for the traditional motor approach, this is also known as the Van Riper approach. It's a motor-based treatment method for speech sound disorders. And again, this is why we're focusing more on that articulation, because we're not really thinking as much about kind of the rule-based errors where they can make the sound, but we're actually working on their ability to physically make the sound. That's the distinction between articulation and phonology. Sometimes there's a combination of the two, but that's generally the case. It focuses on teaching a child how to produce individual speech sounds correctly by progressing through a sequence of levels from correct sound production and isolation all the way to use and conversation. And I mean, if we're producing sounds correctly in conversation, we're in pretty good shape, even if it's not 100% consistent or correct all the time. It emphasizes perceptual training, motor practice, and gradual generalization. So, perceptual training involves activities that help the client to learn how to hear and distinguish between speech sounds, both in other speech and their own. So, a lot of times with our articulation kids, they might not be good listeners. These kids might have had a lot of ear infections when they were little, or just there's something going on with them that they're really not paying attention to the speech sounds. So it can be just a simple motor process issue where they just kind of need extra help learning the correct motor process, but they also could have not developed the correct motor process for the sounds because they just really weren't attuned to what they were hearing. They made a sound that kind of sounded like the sound they thought they heard and moved along. So one of the first things we can do is work on that perceptual training. Are you actually hearing that T? Does this word have a T? Does this word have a T? What is the difference? Really preparing their ears to do some sound targeting work and some motor planning work. Then we are going to move into the motor practice in speech language pathology. This refers to a set of techniques that use repetition to improve speech sound production by training the brain to control the muscles of the mouth, tongue, and jaw. So this is where we are doing that motor learning. We are doing repeated practice of as accurate as possible motor planning movements. And it's with that repetition that motor movement becomes more automatic. And then once we have that correct motor movement, that's when we're going to kind of progress from simple, like sound isolation, like isolated sounds to syllables to words, and so on and so forth. But we really need to do those motor drills to get that motor memory for the correct sound. This approach is most traditionally used for articulation disorders, again, because the articulation is more of the motor sound disorder, whereas phonology, we're going to work on maybe building the rules of sound. Okay, and then we're going to move to gradual generalization. So this is a systematic process of helping a client transfer a newly learned accurate speech sound production from structured therapy setting to all everyday speaking situations. So, gradual generalization. This can be okay, we're practicing the correct, okay, so let's review. We're practicing auditory training, perceptual training. Then we're practicing correctly making that sound in isolation, motor training. Drill, 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 repeat, make sure they have it. Then we're going to gradually keep that correct production in isolation, syllable, word, phrase, sentence. And then the gradual generalization is taking it from sentence and conversation in the clinic to sentence and conversation in the hallway, sentence and conversation in the on the playground, in the classroom. So this is where you can make good use of those little walks to and from the classroom. You pick up your little speech group, and you can be using that walking time to work on these generalization strategies. Come on, everybody, we're working on our ta-ta-tas today. With every step, I want to hear you say ta, 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 ta. Now, everybody think of a T word. Say Tom, Tom. What's another T word? And you can be doing all of this as you're taking your 5-minute walk to the therapy room. Okay, so guidelines for beginning therapy. First, again, we want to establish stimulability. Can they say the sound? And auditory perception. When they hear the sound, can they identify it? We want to teach a child to hear the difference between correct and incorrect productions. This is called auditory discrimination. So we're going to show them a picture of a train, and we're going to say, this is a cane, and see if they say, that's not a cane, that's a train. Play little games like that. See if they can identify, oh, you're right, this is a train, this is a cane. And so they can start to tell the difference between the two. Now, that approach can also be used with phonological processes as well, but still, auditory discrimination. Use identification, isolation, and error detection tasks. So you can even make it a game, make it a board game. Like they get a check or a star if they can figure out when you made a mistake. And then maybe if once they've identified 5 mistakes in your speech, they can take a step on the board game. So you can say maybe you're working on I don't know. Let's think of an easy one. You want to say, I can't go to the store. Let's say we're working on K's because I need a cookie. So you'd say instead, I can't go to the store because I need a bookie. And then they're like, no, you didn't say it. You said a B, not a. Okay, good. You found one. Okay, be a detective, find my other speech sounds, and really work on helping them identify. Um, Establishing the correct sound. So we already talked about this, but this is when we're going to get the child to not only practice the correct sound accurately in isolation, but then we're going to progress through the sequence of increasingly more difficult production. So first isolation, then syllables, then words, then phrases, then sentences, then reading. Now, again, simple reading. We want to make sure we're testing articulation skills, not literacy skills. And then conversation. Okay. Techniques might include phonetic placement. So we might literally be teaching them where to place their tongue, where to place their lips. Like if we're teaching a T, this is when we're going to use our toothpick or our tongue depressor or a pen. And ta ta ta. Feel that ridge and have them use their finger, use a mirror, and we're going to try to show them where to phonetically place their speech mechanisms. We're going to model. We can do over-exaggerating modeling. And if we do the over-exaggerating modeling, we only want to do this for a very short amount of time because we don't want to teach them how to say it forever in this over-exaggerated way. So, for example, if we want to teach the T in butter, we might say a few times for the first couple sessions, butter, butter, but then we're going to slowly move it to butter and move it faster, butter. We're going to model it and then we're going to make it more naturalistic. What we don't want to do is we don't want to keep the exaggerated motions, butter forever for weeks and weeks, because then you're going to have a little kid out in the elementary school saying butter, which isn't a naturalistic production. So, yes, modeling, yes, drawing attention to your face, but then also gradually moving into a more naturalistic version of it. Shaping, this is when we might use sounds that are similar to our target sound that they can do, and we shape that into into the sound that we're actually targeting. So for an example, a shaping for speech sound therapy could be teaching the sh, the sh sound by first reinforcing the child's s, which they already know how to do. And then the speech language pathologist would then guide the child to gradually change the s by shaping their mouth, such as rounding their lips, and then slowly having them move their tongue back. So you're taking a sound they can do, and then you're walking them through how to change it and make the next target sound. And again, we can use things like visual and tactile cues, like the tongue depressors, the toothpicks, using a mirror. We can use diagrams. If you're fortunate, you might have like a little big mouth, little structure in your therapy classroom, so that we can like talk about like where all these are the teeth, these are the lips, this is the alveolar ridge. So really bringing that awareness. Then we're going to move to the hierarchies. We already talked about that, going from isolation, syllable, words. Then we're going to give practice, feedback, and generalization. So we want to provide frequent structure motor practice, because again, we're getting that motor memory, motor learning over and over and over again, correctly over and over and over again, because we don't want to accidentally have them motor learn the incorrect production. And we're going to use high repetition because we want to create that new motor path. And then we're going to give very specific feedback focused on accuracy. We're really going to take our time making sure that what they're doing is actually correct. So what we don't want to do is, we have our group of speech kids, we're on the board game, taking your turn. Okay, Tommy, say a T. Okay, bleh. Okay, good job. Next turn. No, like we're going to take our time. Oh, so close, but I had a little bit of like some lips in there. And there's no lips in a T. Let's try that again. Where's our little ridge? Where's our spot? Put your tongue up. And then wait for that correct production before you're moving on, because you do not want to practice it incorrectly. And then we want to encourage carryover by practicing in real life and classroom settings. This is when you can talk to the teacher and talk to mom, like we always talk about, and just don't have them go crazy. If you're going to have them work on it in the classroom or at home, um, make sure the child still gets to participate like every other student. They get to be a kid at home, but maybe just 5 minutes of check-in in the classroom, 5 minutes of check-in at home, because you also don't want to put too much of a burden on mom and teacher as well. But that carryover of just working on it a little bit in those other settings will really help to give you those booster sessions in between speech therapy. And also teach the child that we don't just make these sounds in the speech therapy room, we do it everywhere, right? Okay. So what is the traditional motor approach appropriate for? It is appropriate for like distortions, like when we lisp our S's. Maybe just some ongoing sound errors that we didn't really quite grow out of. And also errors linked to motor execution difficulties. Some examples of this might be when we're doing substitutions or omissions or distortions, like a lisp is a distortion of an S, and additions when we're kind of maybe we had some compensatory sounds that we used when we were little and we never really um got rid of them. Like if I wanted to say um my maybe mom was teaching how to say bottle when they were little. They said bottle, bottle. And they so now the kids saying bottle, bottle, bottle. Okay, well we want to get rid of that at the end, right? Um, okay, so application and phonological disorders for phonological disorders. Um, you can use these techniques for phonological disorders. Um, while phonological disorders are more often rule based and language based errors, like again, our little example of the little boy who is backing, and instead of saying da doggy, da 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 goggy, where when they can say the D, but they kind of move it back to the G in word, that shows us that is a rule based pattern. But we can use some of these strategies with phonological processes just to ensure that they can actually produce the sound, as well as targeting the more standard phonological pattern approaches. So, in summary, um, in the traditional motor approach, it is motor based, it is sound by sound intervention. It begins with that auditory discrimination and correct production and isolation. That's how it starts. We want to make sure they can hear the correct, hear the incorrect, and produce it correctly at the single sound level. Then we will progress through a structured hierarchy towards spontaneous speech, isolation, consonant or isolation, syllable, word, there, so on and so forth. And it works best for articulation disorders but can support phonological therapy when a child also struggles with motor production. So, this is something to keep in mind because, yes, we want to use phonological awareness, rule based techniques for phonology therapy. However, it is very rare that a child just has articulation or just has phonology. A lot of times it's a mix of the two. So, regardless of who you think you are dealing with, it's definitely worth checking and making sure they can make all the sounds. And maybe there are some sounds, even if it's a little phonological preschooler, maybe there are some sounds that they actually still are struggling to produce in isolation. So, you would teach those first before working on the phonological process. Okay, and then the next section we were going to talk about were the common sound elicitation strategies for articulation errors. So I already touched on a lot of these, but this is how you're going to actually elicit, target, ask the child to produce the sound. Ideally, we're asking them to produce it correctly. These are the things that you can do to do that. So we can use a mirror. This is really big because now we're using auditory and visual. If you have a tongue depressor, you're using kinesthetics, you're using all of their senses. They're in front of a mirror. And then if you're standing next to them in the mirror, not only are you using all of their senses to try to help them produce that sound, you are actually providing a visual model. So now you are using mirror neurons to kind of like help them see you, talk to their brain to give them a better idea of how to produce it. So mirrors can be extremely effective. Um, we want to use tongue depressors because you got to get back there. Sometimes it's back in the back, it's in the K position. Watch out, we don't want to make them gag. But we maybe need to help them move, scoot that little tongue back. Maybe you can't try telling a first grader what a palate is. It's just going to help them to build awareness of the different categories of areas in their mouth. And again, we can use visual models, diagrams, tactile cues. We're going to use the tongue depressor for that. But touch the alveolar ridge. Not only do we're showing them when you touch it, oh wow, okay, now in my head, I have felt that location from inside my mouth. In fact, if you go through and you touch it with your finger, even after the fact, you can kind of still feel where you touch. Like, okay, now put your tongue there. Do you feel it? Do you feel where that was? Um, there's another one too. One of my speech friends who worked with hearing impaired students, she a lot of times used sign. It's like ah, ah, bah, bah. And it just draws attention to the mouth. It draws attention to the different shapes. And even for my kids who weren't hearing impaired and maybe didn't even know that much sign, they just got so used to me using k, k. They got so used to me using the signs that I feel like it almost cued them in more. So definitely look into that approach because I use that a lot. And I found that regardless of who the student was, they seemed to really benefit from that. Um, okay, now let's see. Shaping. So we talked about this a little bit with that kind of S to SH example. Another one is, so this shaping is when you take a sound that the child can already produce and you gradually shape it into the target sound. So maybe like um, if they can say T, but they can't say S, you can have them make a T, 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 then say, okay, now take that T and puff some air out. T, t. Yeah, give puff a lot of air out on that T. T, t. Okay, now make it a little softer, but still give me a lot of air. T, t. Okay, good. Do you hear that snake sound? T, t, t. And we kind of move it forward like that. Another interesting one is maybe they can't do K, but they can say walking, talking. They can say the ing sound. So you can say, okay, say ing, walking. And at the very end, drop your jaw. Walking, walking. Do you hear that clicking sound at the end? Walking. Can you make that sound? And you just kind of isolate, take something they can do and isolate it. Model and imitation, again, providing a strong, clear model. You want to show them nice and slow. They can do it as just do it as slow as they need to do it correctly. Then once they can do it correctly, you can gradually speed it up. So you can be their model. You can do it face to face, but I honestly, I would do a little face to face, but I would do a lot in the mirror because they need to see themselves as well. They need to see how their mouth looks different from your mouth. We can do auditory stimulation and bombardment. So that's when you provide frequent and amplified exposure to correct speech sounds. Um, so this is where we kind of go back to that concept where a lot of times our articulation kids are just not very good listeners. They don't have a hearing impairment, but maybe they're just not attuned. Maybe they had a lot of those hearing, like ear infections when they were little. And so we want to really cue their hearing into building accuracy in what they're hearing. Because maybe they've been saying a sound so long that it feels like they've always said it. So it is right. It sounds right, but really to them it feels right to what they've always produced. But we need to train that ear into hearing the difference. Oh, that is actually not the sound we're looking for. So one cool way of doing this is you can actually get little like FM amplification systems, like little microphones that they can wear. You can get them off of Amazon. They're not expensive, like 20 bucks, and amplify their sounds. See if amplification helps them to better hear the difference between the target sound and the sound they're making, and they tell the difference. And then maybe you take turns and you wear it and you do a incorrect sound and a correct sound and see if they can tell the difference. Amplified so they can really hear the distinctions. Um, we can do listening lists of the target sounds. We can get really used to hearing that L, really used to hearing that V, or maybe really used to hearing kind of those voiced sounds. Um, Minimal pairs, even though that's a phonological process, it will kind of show you the difference between building that auditory discrimination. Um, I think I'm going to drink some key for breakfast. Was that right? What did I say? I'm going to drink some key for breakfast. Is that right? You can't drink a key. You can drink tea from a teacup. So even though that's a phonological process, it can help to do that ear training. Um, we want to do repeated hearing of the target sound and words. Okay, so let's see. We want to do contextual facilitation. So maybe they can say the sound in some context, contextual facilitation. I cannot talk today, sorry guys. Um, but they can't do it in isolation. So maybe they can say the S in blends, but they can't say it in isolation for some reason. So maybe they can say spoon or stop, but when they say sorry, and maybe it's like a little bit of a lisp, maybe it's a little backed. So then we can take what they can say, spoon, spoon. Okay, good. Let's take it real slow. Spoon. Stop. Okay, now let me hear the S and see if you can kind of move it from there. Visual cues, hand signals. I mean, you can even see I'm using my hands a lot. Spoon, stop. There's a lot of these types of things. Or you can use like visuals like spoon to symbolize snake. You can use finger tapping behind the for the alveolar sounds. And then you can use like lip rounding, like we said for the SH. Kind of bring it forward, help shape their mouth a little bit. Um, and then, so along with that, how I was just kind of touching, that's what some physical guidance for prompting excuse me. So prompt is physically guiding or prompting articulatory movements. So that this is a classic approach, but it is something that you need to be trained on. But this is going to use a lot of that touching. We are going to use fingers to provide physical touch cues on the patient's face, jaw, mouth to guide the movements of the articulators, like the jaw, tongue, and lips. So this again helps to assist that motor planning. We can do jaw support. We can tap the alveolar ridge with the tongue depressor. And then maybe we want to work on some like airflow and placement issues. So we can use tools for this. Like we can use, like I said, a toothpick to help them place the tongue or help them find the alveolar ridge. We can use a paper strip, hold it up to their mouth, and see when they blow the air out, does the paper move? We can maybe even put like a little Cheerio or sticker on the alveolar ridge and give them like a little bit of a target. I think that one's a little trickier, but you can try it. Okay, strategies for specific sounds. We talked about a lot of these. Um, in fact, I think I'm just going to skip that because I think we covered a lot of these. So, in summary, SLBs commonly use phonetic placement. We use those shaping techniques where you take a sound that they can do, shape it into the target sound, modeling and imitation, that auditory bombardment, the ear training. We are using facilitating context, so taking where they can sometimes say the letter correctly and try to move it into situations where they can't say the letter correctly. We're going to be using visuals and tactile cues and tools to support articulatory placement. All right, so that is our lecture for topic 8. And now here we go. I'm going to do a little bit of a review of the midterm. I'm not going to go into detail because I definitely don't want to target specific questions, specific answers. But what I can do, I went through all of your tests and I noticed trends for common errors. Now there was kind of a lot, so it's going to seem like kind of a long list. So as you're listening, just jot down what you think you still struggle with, what you feel like you can work on. And then what I'm going to do as well is I'm actually going to start with the categories where a lot of people had errors in these categories. And then the last few things that I'm going to list are the less common errors, but they were still there. So if you were somebody who felt like you struggled on your test, maybe you pay extra special attention to everything. But maybe if you feel like you did pretty good, but you missed some and you're not quite sure what you did, maybe pay more attention to the ones that were more like general across the board errors. Like for example, there were some questions where maybe 7 people missed that question, but then there might be a question where only like 1 or 2 people missed it. So, and again, these are just general topics. So if you want to get a jump start on your final, as well as make sure you're understanding everything up until the midterm, this would be a good place to start. And then I think I will be creating and sending out a final review in the near future, just so you guys can get started on that. Okay, so first, I would say review minimal and maximal pairs. And again, we want to work on application. Okay, so if you see the words and the difference between the words, maybe the IPA spelling of the word, and be able to identify minimal, maximal pair differences, that's something to work on. We want to work on practice analyzing speech sound errors from transcribed speech samples. So this is where we maybe go back to our homework assignments where they had the speech samples written in the IPA and make sure we're really accurately reading the IPA and being able to identify the speech errors. What do the symbols, what errors in that the IPA symbols signify? What are they in, typical alphabetic letters or like speech sounds? Um, Review the term phonotactic restraints. Review various types of assimilation. There's a few, but I think that was something that was kind of getting people jumbled up a little bit. Um, Review all the tongue movement patterns for phonological process errors. So I'm not going to list them all, but for example, one of them is velarization. So make sure you really review all of the types of tongue errors and what types of phonological process errors those can be. Again, review diacritic symbols. Um, just make sure that if it is applied, if the diacritic symbol is applied to a sound or phoneme and it changes that sound of the phoneme, what sound does that create? And what sound does that create as written in IPA? Okay, so we're using diacritics and IPA because we're taking we're taking an IPA word, adding a diacritic, and now we need to interpret that and be able to identify it in IPA. So this is why I said leading up, be really, really familiar with IPA and be really, really familiar with diacritics and be able to use the two together. Okay. Um, we want to look at IPA symbols in relation to place, manner, and voice characteristics. Review the concept of naturalness and markedness. Review a few of your theories. So specifically, there were a few, I'm going to include just kind of some categories of the types of errors I saw. But review distinctive feature theory, um, optimality theory, and feature geometry. Review concepts of typical sequential process by which children learn to physically produce the sounds of their native language and its related terms. So I'm going to say this again. It's a little wordy, but it was the only way I could tell you what to study without telling you the answer. So you need to review the concept of typical sequential process by which children learn to physically produce the sounds of their language. So if you want to chat GPT that to dig into your research, see what it gives you back, use that terminology, go to your textbook, but we want to just review common process of native language development and the terms associated with it. We also want to review anatomical and functional speech sound development in the first and second year of life because there were some errors in that area. Review what changes can happen to speech as the child ages birth to 5 years old. And let me go as far as to say, um, review what errors can develop. There may or may not have been there as the child ages. So, what can start showing up? What can go away? Review phonological awareness as it relates to phonological speech production. Review diagnostic indicators of late speech production. So, if somebody's a late talker or if they're having issues, um, what are some of the more serious things we want to look out for? Or if they're talking but they're developing errors, what are the things that we need to pay the most attention to? So that's kind of using our clinical judgment. Review how to pick target words to help with phonological sound generalization and therapy. We are going to review characteristics of standardized speech sound assessment. Review elements and best practices of assessment of speech sound and phonological disorders. Review etiologies of speech sound disorders and delays. Review terms for vowel and consonant relations in phonology, as well as how to use standard terminology and abbreviations to describe these vowel consonant relations. And then we're going to review highly common American dialect variations and their general characteristics, as well as how to rule out speech errors being caused by a dialect as opposed to um, like a speech sound error. And that can go either way. So, how will we tell this is from a dialect? Or what if a child has a dialect, but they also have a speech sound error? How are you going to tell that that is a true speech sound error and not a dialect? And review best practices of speech sound assessment for children who speak a different language. So that's all the sweeping categories of things that you could have an error on. These were the very, very rare errors. But again, if you feel like you did really poorly and you kind of want to know a few additional areas to study, this might be you. So we want to review types of errors like substitutions, additions, distortions, omissions. We want to review methods of collecting speech sound data. Remember I said review all your worksheets, including that one from the very start of the semester that kind of discussed the topics of phonetic, phonemic, phonotactic, allophonic terms. Make sure you know that. Make sure you know your tongue position and vowel positions. We want to review culturally and linguistically diverse ethical considerations for analyzing speech sounds. Review manner of articulation, and that's again manner of articulation. That's a specific category, so make sure you know what those are. Review sound substitution phonological processes. Two more. Review clinical judgment making hierarchy for diagnosing phonological disorders, and review elements of an oral mechanism exam. So, as you can see, the list is pretty intensive. I think it's just because there were different errors across different people across the board. But the good news is if you kind of start reviewing this now, there's going to be a lot of crossover to the final exam. So it's worth your time just to go back and make sure that you firmly understand these concepts, not only to fortify your own learning, but as maybe like a little bit of a jump start on the final so that you're not kind of cramming for the final on the last day. All right, guys, hope this is helpful. Yeah, and then I will see you guys soon at our next mini lecture. And you got this. Thanks.